The RWHC has been providing affordable and effective services to healthcare organizations since 1979. RWHC is owned and operated by 43 rural acute general medical surgical hospitals, including Tomah Health, right here in Tomah. It is a pleasure to welcome virtually the Executive Director of the Cooperative, Tim Size. Welcome, Tim. Thanks for joining us on the Hometown News.
Thanks for having me.
Well, Tim, can you tell us a little bit more about the Cooperative and how it works with hospitals like Tomah Health?
I'm very happy to. We were founded by 5 rural hospitals in southwestern Wisconsin in order to explore the opportunities of working together. Our bylaws were borrowed from a dairy cooperative. We crossed out the word dairy and wrote in hospital. We were then and are now very careful with the dollars we spend. But we work just like an agricultural co-op in terms of the hospitals controlling what we do. Our first office was one room in what had been a dormitory for nurses in Dodgeville. A couple of years later, as the Cooperative's membership grew north and east, we moved to Sauk City, where our offices and training center remain today. A couple of weeks after I was hired as the co-op's first employee, there was a proposal from a federally funded health planning council to close or merge most rural hospitals in southern Wisconsin. Once people in our local communities learned about that proposal, it was quickly defeated. From that day on, speaking up on behalf of rural healthcare has been central to the co-op's mission, and it's work I love doing, and it's a privilege to do.
Sounds like you've been an anchor for them. You've been there historically really involved a long time, Tim.
Yeah, it's rare, I guess, that someone gets to work in the same job for 40 years, and I love it as much today as I did then.
You can tell that you're very passionate about it, which is great to see. WRHC has maintained a philosophy of bigger isn't better, better is better. So can you tell us about rural health and its role in the healthcare across Wisconsin?
I'm very happy to. Just like across all of rural America, rural health provides local life-saving care. A local emergency room can mean the difference in life and death. Having quality emergency services can also help the town attract businesses, industries, and increasingly retirees. Rural health provides specialty and primary care close to home. Without local rural health care, many of the over 1.5 million people who call rural Wisconsin home would need to face long drives and time away from work, with many elders depending on others for that transportation. Rural health provides personalized care. Healthcare is a very personal experience, and the compassion of neighbors taking care of neighbors, combined with local state-of-the-art technology, is what makes rural health special. Also, though, I want to add, rural health is critical to the rural economy and the health of the people that depend on its jobs and income. Hospitals are large drivers of rural economic activity, and continuing to deliver care in rural settings has far-reaching economic impacts that cannot be overlooked. An average rural hospital generates 170 jobs, 7.1 million in salaries, wages, benefits, and every dollar spent by a hospital supports over $2 of additional local business activity.
That is a really significant economic impact then for those rural communities, Tim.
Very much so.
Well, your mission focuses on being the rural advocate of choice for your members. What is your current top advocacy challenge right now for rural health, Tim?
Well, our current biggest challenge, we have a lot of them, which I could spend all evening talking about, but I know we only have a few minutes. But our current biggest challenge is unchanged for the last year and a half. And that's to reduce the harm of the COVID virus to people's health and to our local economies. The new Delta variant of COVID, which some of you may have been hearing about, now accounts for about 20% of US cases and is doubling every 2 weeks. That means it's going to be the dominant virus across the country, including Wisconsin, within the next month or two. This virus is much more contagious and more dangerous than earlier variants. It's likely to become dominant, as I said, but the implication is the outbreaks this fall, with individuals unvaccinated the most at risk. The good news is that if you're fully vaccinated, our experience to date suggests you remain protected, that the vaccines are doing their job. In Wisconsin, we need about 4 of every 5 people around the state to be vaccinated or who have had COVID to substantially limit the risk of new outbreaks. In rural Wisconsin, that means we need 500,000 more people to be vaccinated. And that sounds like a lot of shots in arms, but for the average rural county, that means about 200 people per week over the next year. That is doable if we have the will. Examples of helpful messages we need from trusted local leaders include that the vaccines are nearly 100% effective at preventing hospitalization and death. And although the vaccines are new, scientists have been working on the technology used to make them for the last 20 years. And the vast majority of doctors and nurses have asked to be and are vaccinated.
Wow.
I think it's an important issue. I know not everyone agrees with me, and I just hope folks seek the information they need to feel comfortable if they haven't yet been vaccinated.
Well, and it's nice to have that information available to those who may need it. Healthy hospitals lead to healthy communities. How can residents help to ensure quality health care options remain viable for rural communities like Tomah?
For most of us in rural healthcare, 2020 was the most challenging year we have ever faced. And as you can see, I've been doing this work for a long time, and it's by far the most challenging year and a half I've ever had at working in rural health. But most commercial insurers reported record profits for the full year of 2020 because their members could not or did not visit the hospital or see their physicians at usual levels. It's really a mystery to me why some insurers are now choosing this time to come down so hard on rural healthcare. In any event, these behaviors have led the Cooperative to establish a set of expectations for health insurers, which will drive our advocacy and is driving our advocacy. We need all employers, including government and school districts, to pick health insurance for their employees that assures that they can readily get care locally. Rural-friendly insurers don't steer care away from the local hospital. All services that can be provided locally are covered by such an insurer. When health insurers deny care to the local community, it's important that all of us exercise our rights to file a complaint with the Office of the Commissioner of Insurance in Madison. This is easy to do online, and if anyone needs help doing that, I'm sure they can ask Tomah Health if they need help or email me at the Cooperative. Medicare, Medicaid, and commercial insurers need to reimburse the real cost of efficient rural health care, or we just simply will not have it. In turn, as rural hospitals, we know that we need to step outside of our four walls to partner with the local community to do both community and economic development initiatives like broadband, like housing, like transportation. Hospitals can't be responsible for it, they can't do it all, but we need to partner with the rest of the community to deal with those important issues. We know that as hospitals, we can only be as strong as our local communities. I need to remind everyone that the future of rural hospitals is up to all of us. 40% of all rural hospitals in the country today are either at immediate or high risk of closure. That percentage is significantly lower in Wisconsin, but it'd be foolish for Wisconsin to assume we are immune from these trends.
Well, Tim, thank you so much for taking time to be with Charity and I this evening, and good luck with all of your challenges. And thank you for your dedication to rural health. Thank you.
Well, thanks for talking to me.
Well,